So here is our update on brain research for the past month, and we're doing things a little bit different as opposed to having a daily video. My students tell me that's very boring. We're condensing everything into 1 month. So with regards to brain and research right now, what's the latest is we have a couple different things. On the level of basic science, we have a study that shows us exhaling allows for better blood flow into the brain. And this has been proven with a 4D MRI. Why is this so important? We find that a lot of lifestyle factors lead to people having a forward head. Now that forward head increases the tone in these muscles back here, the subaxial muscles. And the subaxial muscles are in a spasm or tense. They prevent drainage of waste from the brain out. What puts us in that forward head position? Often the things we're looking at, like a screen, or the things we engage with in life. Sometimes the way we engage them. You don't have to engage a screen like this. You could engage it like that, where the subaxial tone is less. But it's a very nice study that actually proves that exhalation and inhalation relate to brain blood flow. Now, what do we do with all that information? If the drainage from the brain is getting affected, we know that waste is collecting. And how do you prove that? Looking at the glymphatic system. So here we have a study that looks at perivascular space increase, and that's in diabetics, and those are even autoimmune encephalitis, 2 different studies. But it shows us perivascular space increase correlates to worse dysfunction of the glymphatic system. And this again links into subaxial muscle tone. So now we have a way to improve blood flow, improve the drainage, and also proof that if there's a disease, it's not going to be working that well. From there, we have a different thing. This is an interventional study looking at ketamine and disorder of consciousness. So this group has taken people with a disorder of consciousness, they've given them IV ketamine, and they've seen what changes. And what does change is these people's spasticity comes down. But in the process, they might become a little more responsive, but there's no meaningful change. Which is not really a surprise. It's the brain that's damaged. You don't expect them to get up and start dancing around in a productive way or a meaningful way, maybe from spasms of pain. But if you can get a person better quality of life, it can help. And it's not really a surprise that something like ketamine could actually help. It takes out the spasticity. If the brain is not being bombarded by spasticity signals from the muscles, it can show you what it actually has. I think it would be a good diagnostic tool to unmask a person's potential, to show you how good they are, and decide further what the quality of rehab would be. If they only need palliative care or maintenance care, and you run a ketamine drip and they show you no change, you know what your goals are. If they come into you unconscious or in an agitated state and you give them ketamine and they start talking to you, that's someone who has rehab potential. This would be a nice way to separate those kind of patients out. And then prioritize and make goals. So along that way, planning trajectory and rehabilitation, we have another study looking at pediatric traumatic brain injuries and trajectory of recovery. And they look at how these children do over 1 year and what factors lead to a better outcome. The factors leading to a better outcome I have to read to you. But EEG grade 4 or lower, 1, 2, 3, 4 on a Young's classification, no bilateral basal ganglia involvement or posterior cingulate or frontal or occipital lobe damage. Now if those are damaged, then you're going to have less chance to wake up or better outcomes. Along the way of looking at trajectories and planning how things go, we have a study looking at MRI to predict the emergence of Alzheimer's from a minimally conscious impaired state. So these are people who are conscious, but their cognition is minimally impaired. And now, do they progress into Alzheimer's? They could, but how do you know? They have a machine learning, artificial intelligence study that they've done looking at MRI of the brain to see who's progressing and what areas indicate that. So again, this is really important when you do this kind of cognitive rehab work. The last thing we're going to look at is sleep and cerebral palsy. So all these things link together: brain health, muscle tone, respiration, quality of sleep. But in children with cerebral palsy, they may have sleep impairments. And if they do, what's making that sleep impairment? What makes a sleep impairment would be either them having a male gender or having an underlying mental health condition. Why being male leads to sleep impairment is not clear, but that is what the study found. Why they have a mental health issue leading to sleep impairment is kind of obvious. If the body and mind are not relaxed, they won't sleep properly and reach stage 4 of sleep, so the body can't relax. But that is our mental health and brain research review for the month.